The government's temporarily toughening up managed isolation rules in the wake of a growing number of community COVID cases. 3 people are now confirmed to have caught the more contagious South Africa strain of the virus from a fellow returnee in managed isolation. A Northland woman, a father and his young daughter were allowed to leave the Pullman Hotel after initially returning negative tests. Swipe card data shows the so-called index case and 3 returnees were out of their rooms at the same time on various occasions and various combinations, but the exact means of transmission is not yet known. The Pullman Hotel is not taking on any more returnees until officials find out what exactly has gone wrong. Once the hotel is eventually empty, it'll be deep cleaned. In the meantime, across all MIQ facilities, all returnees will be confined to their rooms for the final 3 days of isolation to avoid any cross-contamination. That's a temporary measure at this stage. And in the past hour, Australia's Acting Chief Medical Officer, Michael Kidd, has hit pause again on the Trans-Tasman travel bubble until at least Sunday.
We know that 12 people who are in quarantine at the Pullman Hotel have arrived in Sydney. 3 of these people have travelled on to Hong Kong and the authorities there have been advised. 2 of these people travelled on to Queensland and the authorities there have also been advised. The others are all being followed up in New South Wales and are being tested. If I receive additional information about further arrivals, I will provide further advice. On Monday, I advised that anyone who had arrived in Australia on a flight from New Zealand on or since January the 14th should isolate and arrange to get tested and remain in isolation until their results are known. I'm now extending that advice. Anyone who has arrived in Australia on a flight from New Zealand on or since January the 9th is asked to isolate and arrange to get a test and remain in isolation until they've received a negative test result. In particular, if you were in hotel quarantine or a guest or a staff member at the Pullman Hotel in Auckland between January the 9th and January the 14th, please isolate at your home, arrange to get tested for COVID-19 and follow the advice of the health authorities in your state.
Back here, I asked Director General of Health, Ashley Bloomfield, how the 3 infected people might have come into contact when they were out of their rooms.
What I can say is that there was no point in time when all 3 were simultaneously out of their rooms, but there were a small number of times over a 3-day period when the index case and one or other of the other 2 or the other 3 were out of their rooms. And they're periods of time that vary from a few minutes to perhaps half an hour, often coinciding with exercise breaks perhaps. We're still looking into what the nature of any interaction might have been, in particular whether they used something like a lift either at the same time or, very close in very close proximity to each other time-wise.
Do you suspect they were exercising at the same time in the same area?
That's possible, and that's one of the things that will be looked at. So far, there is no evidence for that, and there's no CCTV footage for that. So it may well be more that they were just passed through a common area if we're thinking about the possibility of airborne transmission, or that, that fomite transmission, one used the lift straight after the other and there may have been contamination there. Those are the things we're looking at.
The man and the young girl, who are now confirmed as infected, when did your contact tracers talk to them and when exactly did they have their first test?
So they actually had their first test the day before yesterday. The results came back yesterday, my recollection is late morning, and then the contact tracers spoke with them, got people to go out and do a retest because those first test results, and I spoke to the team in Auckland and my team here, it wasn't clear whether this was definitely a current infection or an historical infection, or indeed, as we had seen the day before, actually one that had turned out to be a false positive. So urgent retesting while the interviews were done. Auckland Regional Public Health then started as a precautionary process to contact some of the places they had been just to give them a heads up. And as soon as we had that second confirmatory test back and we had agreed, yes, this does look like these are acute infections, that's when we sent the information out more widely.
So were they out and about while they were waiting on test results?
No, they weren't. As soon as they were contacted by our contact tracers and asked to isolate and be tested, they did isolate then.
Once they had direct contact. But when you made that general appeal on the Sunday that people should stay home, get a test and not go out until they had a result, did they not hear that message? Because they subsequently were out and about, weren't they?
Yes, they were out and about, and look, I have to assume they didn't hear the message, and the people who spoke with them will know more about that than I do. But, what I can say is as soon as they were contacted and asked to isolate and be tested, that's exactly what they did do, and then remained isolated until the result came back.
So are you getting to people fast enough then?
Oh, I think we're getting to them very quickly, actually. Our team has, managed to get to all 354 people who had been in the Pullman. They were working, right through the day and into the evening from as soon as we knew. And I think it was a good call for us to follow up and call each of those people.
But you have two people here who've been wandering around for 2 days before they hear from you directly and then self-isolate. So that's 2 days where they could have been in contact with hundreds of people. That would suggest you're not getting to them fast enough, doesn't it?
It does mean there were 2 days, but I can tell you our team were working hard and we did get to everybody, which is, I think, a very good result.
The genome sequencing connects these two latest cases to the Northland case and the so-called index case. But how close is the connection? Could there be other cases in between the Northland case and these two?
Well, that's something we do consider. What I can say is in the case of the Northland case that we found out a few days ago, the genome sequence was identical to the index case. In this latter two, there's a slight difference in the genome, but they're clearly linked. Now, they do change, from one person to another. Sometimes they don't and sometimes they do, but there's nothing to suggest at the moment that there's an intermediary between the index case and these two latest ones.
So what's happening with people at the Pullman at the moment? So you've got a no new people in, no people out right now. How much longer will returnees who would have been due out, do they have to stay there for?
Actually, we kept the people who were due to go yesterday. They were kept overnight, but then they were released around the middle of the day today because they had all been retested and returned a negative test. The thing we have implemented in the Pullman and the EMB team is implementing across our managed isolation facilities is until we've really got to the bottom of this as an interim measure, we're keeping people in their rooms after that day 12 test just as a precautionary measure. And once we've got to the bottom of this, we'll see if we're going to continue that.
So you are releasing people from the Pullman on a daily basis now?
Certainly the people who were due to go yesterday went today, but what we are doing now is, of course, keeping them in their room after that day 11-12 test.
So you would have locked people down, but people who would have been due to leave today, have they been allowed to leave?
They are allowed to leave. Whether they've gone or not, I couldn't say. But there's no, now that we've got this arrangement in place where people are in their rooms after that last test, then we feel it's safe for them to leave.
The Minister has said there's something wrong at the Pullman, and obviously we can see that. You have people now, some of them locked in their rooms. Are they safe there? Because you haven't worked out exactly how this is spreading.
Yes, we do think they're safe there. And one of the things I would point out is that all three of these cases have been infected from the one index case. The latter two cases that we talked about last night and released last night haven't been infected by another person. So we've got sort of a common exposure event here, which suggests there was a specific issue there rather than a more systemic problem. But of course, what we want to do is rule out any systemic issue. And there's a lot of extra work that's going in the Pullman to make sure people are safe.
I was interested to hear that there's going to be a change in procedures, that staff working at managed isolations will only be allowed to service basically one MIQ facility. So have staff working in these hotels been moving between facilities?
There are some staff who do work across different facilities, not all of them. Obviously, the hotel staff are dedicated to their hotel, but sometimes different staff who are rostered on from the various organisations that contribute, like health, like Defence Force and so on, they do work across facilities. But remembering they're all on a testing regime and they are all working to the same high levels of infection prevention control.
Understand that, Dr. Bloomfield, but isn't it basic infection control to kind of not mix those people up?
The basic infection prevention control is to apply the same rigorous processes and procedures at every organisation that people are working at, so they know exactly what to do, the same thing at each place.
But why isn't it good enough now when it was previously?
Well, it's just a precaution we're taking, along with a number of other interim precautions, and we're just providing extra safety here while we get to the bottom of this.
Outside of the Pullman, or just generally, how many people have caught COVID in managed isolation?
Actually, that's a question I've been asked earlier today, and I've got the team member here with me who's going to find that information, and we will make that available.
Have you been tracking it?
Yes, we have. We look very carefully at every case that comes up with a positive test. If they've had a negative test early in their stay and then subsequently return a positive test, we want to rule out whether there's been any transmission inside the facility. Most of them are historic cases, or they are just a late presentation of an acute case.
You mentioned confining people to their rooms for 3 days after the day 12 test. That is a temporary arrangement, according to the Minister. What would you need to see to make that a permanent requirement?
Yeah, look, it's an interim recommendation, and we're looking at the full range of things we might do inside the facilities to help reduce any residual risk further. And one of those, a really important one, is the cohorting of people when they come in that the Minister spoke to today.
And that was Dr. Ashley Bloomfield.